I am at risk of getting infected with COVID-19 if the food service worker or delivery person cough or sneeze on my food and packaging. Also, I've heard that I should disinfect food packaging. What is the best way to do this disinfection?
Hi, I'm Dr. Beth Demings with the Institute for Food Safety at Cornell University. These are two great questions. Let's tackle that first question. So first off, it's highly unlikely that a food service worker or delivery person would cough or sneeze on your food or food packaging. Measures to prevent this type of scenario from playing out were established long before the COVID-19 pandemic, and this was to ensure safe food handling practices. Additionally, it's even less likely to happen now because food service workers or delivery drivers are wearing face coverings, which in turn prevents them from even being able to sneeze or cough on your food or your food package because of that barrier that the face covering creates. But what if it did happen? So if a food service worker or delivery person did sneeze or cough directly on your food or your food packaging, it would still be unlikely that you become infected with COVID-19. And this is because the virus that causes COVID-19 is very unstable outside of its host, and it becomes inactive at a rapid pace on most surfaces. Now for the second question. What is the best way to disinfect food packaging? The simple answer to this is that food packaging should not be disinfected. The virus that causes COVID-19 is primarily spread from person to person, which is why social distancing is such an important mitigation strategy right now. There is very low risk associated with surface transmission. And in fact, if you disinfect food packaging, it actually introduces an entirely different health risk, which can have severe consequences, and that's chemical intoxication. Disinfectants, soaps, acids, and other chemicals that you find in cleaners and sanitizers can be harmful if they're ingested, and they are not designed to be used on food or food packaging. Typically, these are meant for hard, non-porous surfaces, like your kitchen counter or the tile in your bathroom. They're not meant to be used on absorbent surfaces, which are things like the skin of fruits and vegetables, paper or cardboard, or the things that your food packaging is made out of. And so this is why you should not disinfect your food packaging. So what steps should you take if you have food delivered? The main risk when you order delivery is coming into close contact with the person who's delivering your food. Practice social distancing by instructing the driver to leave the delivery on the doorstep, or wear a face covering if you must come into contact with them and cannot maintain a distance of 6 feet. Wash your hands with soap and water for 20 seconds after you receive the food. You can take the food out of its packaging, plate it, and then discard the packaging. Wash your hands again after you finish plating your food and before you eat. Remember, these are simple steps you should take if you have food delivered. Practice social distancing or wear a face covering if you come into close contact with someone outside of your household, and wash your hands frequently.